If you take it like this, then you will get it good. Okay. So welcome to ENT student. Now we are trying to demonstrate a model of oral cavity and tongue so that we can use the lax tongue depressor. So this is the tongue cutout wherein we are having anterior 2/3 and posterior 1/3. And later on we try to make a model of this oral cavity wherein this is the soft palate and this is the upper jaw and this is the upper lip and this is the lower lip. It's just a simulator model and this is low fidelity model. We're not saying it as a best model, temporary model which everyone can make. So this is the soft palate and this is the upper jaw and this is the gingivo-labial sulcus and this is the gingivo-buccal sulcus. So we are trying to oppose this oral cavity with this tongue. This is the anterior 2/3 of the tongue. So once you are trying to use the lax tongue depressor, what you have to do is, suppose the mouth is closed like this, you have to take the permission of the patient and try to put it here and hold the tongue depressor like this as you are holding it here and try to put it in the anterior 2/3 only. Don't go to the posterior 1/3 and try to open the oral cavity like this. So see the posterior pharyngeal wall. You have to see the posterior pharyngeal wall. Of course, you put the hand here like this. That will become the posterior pharyngeal wall. We can attach one more model to that. This is the posterior pharyngeal wall which you are able to see. When you push it down, you can see. Don't put it in the posterior 1/3 of the tongue because it causes gag reflex and patient will go into vomiting. And what are all the other structures you have to see is, number one, gingivo-labial sulcus up, gingivo-labial sulcus down, gingivo-buccal sulcus left, gingivo-buccal sulcus right. There is something called as retromolar trigone in this region. This is the retromolar trigone region. You have to examine the soft palate, you have to examine the tongue, upper part, that is dorsal part, you have to examine the tongue, ventral part, you have to see the frenulum, you have to see the opening of the ducts of the salivary glands like sublingual salivary gland and submandibular salivary glands. And while in the gingivo-buccal sulcus, upper second molar level, you will have the parotid gland to see. So all these things along with the anterior pillar which is supposed to be palatoglossus, posterior pillar which is supposed to be palatopharyngeus, and while dipping it down, you can see the tonsil in between the palatoglossus and palatopharyngeus. We are not showing the tonsil in this, of course. So tonsil will be located at this point and this point. So by this way you have to hold it. And when the patient is supine like this during tonsillectomy surgeries, you have to use the tongue depressor on the other side and you can lift the soft palate and see the nasopharynx also like this. Okay, put the hand down. So this is the nasopharynx which you are able to see behind the soft palate. So this is the basic paper model of oral cavity and oropharynx and tongue for utilization towards the competency number 2.6, EN 2.6, which is demonstrate the correct technique of examining the throat including the use of a tongue depressor. Okay, thank you very much.